Hello, what's up, all our Support Fibro friends? Good morning or good afternoon if you're on the East Coast in Brandy's time. Happy Friday to everyone out there. We're excited to be back on a live broadcast here with both Brandi and I. So it's so good to see you and just being able to chat. Please let us know where you're tuning in from. Say hello, drop an emoji. Let us know how you're doing. If you have any fun weekend plans, be sure to say hello to us. And I just wanted to give a special shout out to Purple Ribbon Advocate over there on Instagram, because I know her and I are both in California time. So 10 a.m. It is definitely a good morning to us. And I know Brandi, like we get ruled out by the East Coast because it's 1 p.m. Eastern over there for Brandi. So it's a little bit later. So we make a compromise here. But welcome to all our Support Fibro friends. I am Melissa Talwar. I am the Executive Director of the Support Fibromyalgia Network. And I'm also a board certified functional medicine health coach.
And I am Brandi Privetera, the Director of Program for Support Fibromyalgia, and I'm also the blogger at Being Fibromom. And I am the breaker of things because right before we went live, I broke my microphone and I was desperately trying to fix it before you brought me on. I was like, oh man, the whole thing just came down. We're good though.
Oh my goodness. Well, and too, I think I broke our stream. We had everything nicely set up and I switched something because we switched our background here and it totally changed some stuff for us. So yeah, I guess we're both like destructive right now. So we'll just roll with it on this Friday and everything and we'll go with it. And shout out to Carrie. Sending you lots of hugs. It's really good to see you. We love Carrie and we'll hear from her more this year, as well as we have some plans coming up. Hi, Janice. Great to see you from Pennsylvania. I hope the weather is going okay because I saw there was a lot of weather activity for our friends in Michigan and Ohio. There's a lot of stuff. She brought up, oh my gosh.
I touched the duck. I did the duck.
Yes. Okay. So, she did touch the duck early on and disappeared on me in mid-sentence. So this is beware. It was a theme last year of the duck. So, yes, no touching the duck. You leave that StreamYard duck logo alone. Otherwise, you will be kicked out. And Brandi definitely learned that again this morning. So
it was so funny because I clicked it, Carrie, and then I was like, oh man, I wasn't supposed to click the duck. And then I came back in. Melissa's like, did you click the duck? Don't click the duck. And I'm like, dang it, I forgot about the duck. I remember.
Well, we definitely, it's been an adventure in the summer, and that's the kind of stuff like for today's discussion, we want to talk a little bit about some of the things when it comes to related to toxic people, setting boundaries and have an engaging conversation with everyone out there. Please chime in, especially when it comes to workplace. If you are able to work, we have an interesting conversation there. We're going to give some of the updates that we did have on our adventures this summer. I'm retiring as a storm chaser. So it seems like storms seem to follow me and a lot of chaos lately. And I'm learning. So we'll probably talk about that because it's definitely been an adventure. I don't know how you guys handle all those weather changes, but being in California based, I started to feel in the last couple of years, I've been noticing more of those barometric changes. But definitely going on to the East Coast during a lot of this summer and all this stuff happening, boy, was I really recognizing what a lot of you go through with the different storms and navigating that. And I've never been in a flash flood emergency, always had flash flood emergency, but like it's been a lot with the weather. So I think I really want to retire from being a storm chaser, but it seems like weather patterns are following us here, even with the hurricane in California headed that we just went through that. So I don't know how you do it.
I think it's the East Coast trying to keep you here, Melissa. I really think that's what it is because like every time you come over here, it's like, you seem to like your sleep better. Like we get a lot of stuff knocked out and everything, but then the weather comes with you. And it's almost like the East Coast is like, stay here with us on this side.
Well, I had enough flight delays, but it was definitely fantastic. Spending time with Fibromyalgia Pain Chronicles is here actually. And I definitely attest, slept better in Cleveland, Ohio for sure. So it was good to be on the road. It's good to see people and other advocates, but the weather is definitely it got the best of me with all the flight delays and stuff like that. And we had a train that we had to evacuate because we were in a flash flood emergency where the train tracks got wiped out while we were on the train. So again, I think I've had a little bit too much of an adventure and a sympathetic nervous system jumpstart this summer for us.
And I think those of us on the East Coast that have, the humidity and the weather and stuff, I think we're not used to it in the fact that our body doesn't respond to it, but in the fact of like we get used to it. I only really feel a change in the barometric pressure when we have a major storm coming through. But I think those people that aren't used to it, like anytime a little storm comes through, you definitely feel it. But yeah, this was a crazy busy summer, not just with weather, with everything. Oh, we have someone in South Carolina. Nice.
Yeah, I mean, welcome. Definitely. I know you've been asking some questions. I replied to you in YouTube, so hopefully it's helpful, but maybe we'll do a separate video on some of the stuff that's coming up with that trial in particular, or questions too, as well. Because one of the things we've been reflecting on as Brandy's been supporting me through this as well is just having an open discussion on some of the toxic people we might have in our life. So that's or toxic, in my case, toxic boss, workplace. So how do we set boundaries? And it really has me reflecting on this aspect of having a chronic illness and then actually trying to work, and the insecurities that I know I have insecurities about it. And so wanted to just even open up these discussions when it comes to that, and eventually even doing a more of a full video on this topic, because I know if you are able to work, what are the benefits? Like what can you do to take care of your health while you are working, and those tips. And also kind of finding out, do you feel a lot of fear to like advocate for yourself in that space? And I opened up to Brandy on the road that I definitely do feel that aspect, because having a chronic illness from an early age is hard to hold down work consistently. And so I'm very insecure about these things, and I do have a lot of fear. So I'm willing to take on more of the types of abuse or terrible work situations like I was in for a much longer just to get the paycheck and survive. So these are some things that we wanted to reflect on too with the community a little bit more. And then of course there was some people, you can't necessarily get rid of family completely. So setting boundaries with that also came up. But Brandy, when it comes to these situations with boundaries, are there any tips that you have, or the most important things you've kind of noticed when setting boundaries with some of these people that invade, or energy vampires, or have this toxicity?
It was really interesting that you brought up that you wanted to talk about this today, because I was having a conversation with a support group leader earlier this week, and she was bringing up about how she was having a flare and some symptoms, some new symptoms for her, and she had to establish these boundaries. And she was saying, I just had to set these boundaries, and I just had to tell people I can't do it right now. And after she shared with me, I said, kudos to you for not only setting those boundaries, but respecting those boundaries. So a lot of times we know what we can and cannot handle. And sometimes we're saying, okay, these are the boundaries, set them with yourself and with other people. But it's being mindful of those boundaries and respecting them yourself, because people are only going to treat you the way you allow them to treat you. So if you set those boundaries, you got to make sure that you respect those boundaries. But then I noticed that when we start talking about boundaries, it seems like a lot of guilt comes up for setting those boundaries and asking people to respect them. And, it's natural to have that feeling of guilt, but you shouldn't feel guilty for taking care of yourself, because if you can't take care of yourself, you can't take care of, your loved ones, your friends, and as it goes outward. And that was a conversation we had this week. So I thought it was amazing, Melissa, that you brought that up. And then you were like, well, what about the workplace? And I was like, wow, that's a really good question, because the only time fibromyalgia for me really flared up, I was working for a rheumatologist, and he knew that I had fibromyalgia, and he would tell me, don't wear those shoes. Those are really bad for you. You know, take more breaks, stand up, stretch. He'd be really mindful of telling me things, because he knew I was doing the job of like 5 people for an entire department. And he was really mindful of that. But what if I wasn't in that environment, and I was still like, if I didn't work for him, but I was still trying to do this job? Would I speak up and say something? What would that look like? I really am forthcoming with information, but I just don't know how you would bring that up. I mean, because Melissa, you brought up a really good point, is when you say these things, how is that, what's the consequences of that? You know, are you going to lose your job, or other people like going to distance themselves? And, you know, it just brings up a whole bunch of other things.
Absolutely. And this reminds me that this is a great conversation to take to inspire the community, because you can post anonymously. So this is where we love Inspire, because you can anonymously, you can be anonymous when you have these conversations and really share like the truth. If you are currently working in a position, do you feel comfortable enough to be advocating for yourself to get accommodations? Or do you feel like there'll be retaliation? I mean, this is all across the country right now, and it's just not necessarily with chronic illness conditions, but I think there is going to be some more prevalence within our community for fear of any retaliation, because we have to, you know, if you want a paycheck, like what does that look like? And we're finding the line between like, are you even able to work or not, and sticking through it, and what that takes. So it's definitely a challenge, and that's why we wanted to make sure to open up this discussion with people, to see what they're doing. Because some of us, you know, I know there's people out there that are great advocates and they know the rules legally, but I know that there's other of us that don't like to rock the boat as much. So, I mean, we need the paycheck, we need to support their families, we need to go through this. So, like, what do we actually have to do to sustain that, and what that looks like? So, I mean, it's definitely a tough topic to navigate moving forward. And then, like Brandy mentioned, with the boundaries and family, I'm terrible with it. So I just cut people out. I mean, I love the people that are willing to work with other people about it, but with me, my personality, like, you know, whether I like you or not. So I just be like, I'm done. So I eliminate everybody, because I'm not very good with boundaries. I'm an accommodator by nature. I like to accommodate. And Brandy saw this too. Like, I asked everybody, we had an instance where I was like, yeah, let's order food. I ordered everyone's food and forgot to order food for myself. So I'm like, oh, okay. So I know that I'm naturally accommodator. So for me, I struggle with boundaries a lot. So I tend to just eliminate those people completely rather than trying to set that boundary, because I don't know, I just had a tough time with it. I mean, Brandy, when you do stuff and things I noticed too, just in my personal life where it's hard, is there a lot of people that set boundaries for themselves? But then when you try to set boundaries, like they get all like unnerved, like you, so
Oh,
like
yeah.
what do you do with those types of people?
Uh, well, in some instances, I can't just dump them. I did that at one point in my life. I was like, you know, cutting it out, because, you know, Dave and I were a lot like that. We just get tired of dealing with it, and it's just easier just to cut out and walk away. But then I realized I was really isolating a lot of stuff. And, you know, some people may not understand that they're doing it. They may not understand that they're crossing those lines with you, and crossing a lot of things. So like bringing it to their attention and give them the chance. You know, I can be a very overwhelming person. And not until I got with my husband that he was like, well, okay, you got to calm down. I didn't realize how overwhelming I can be. So just bringing it to their attention. But yeah, I've been in those situations where I'm like, okay, like these are my boundaries, and you know, you need to respect them. And it doesn't mean I care less about you or about the situation. It's just I have this going on, or I can't give you my full attention right now because I'm really distracted. Can we do this at another time? And that's what I'm trying to do. And they can do it, but when I do it to them, it's like, oh, well, you just don't care. You don't do this and you don't do that. And it's like, that is completely unfair, to the situation for both parties, you know, like, because you could be having a great relationship, but then because you can't respect the other person when they're trying to respect themselves, how can you have a healthy relationship? And Melissa, you brought up something in our past conversation about this is when you're trying to address the situation, to just be the logical, like try to remove that emotion and be logical. For me, I'm a very highly emotional person. When I'm upset with you, you're going to see it. It's going to be written all over my face. I'm not really good at hiding my emotions. But when I try to get to the core of something that's really bothering me, or I feel like it's going to build up and it's going to cause issues, I try to step back, find out, like try to work through my emotions and say exactly what is causing it. Is it something I feel about myself that it brings up? Is there a particular action? When you bring up to someone, they don't want to, when you talk about a problem, they don't want to have like their character attacked, right? They don't want to feel like they're less than. So saying something about their action instead, like you did this and this is what the result of it was and how it affected me, and addressing it that way rather than attacking them, and really try to remove that emotion. When my kids get upset because I say something and they start getting upset, whether it be crying or screaming or mad or whatever, I'm like, okay, the first thing I'm do is I'm not going to hear it. I'm like, okay, let's calm down. Let's make sure that we're breathing okay. Let's get our thoughts in order. And then let's address the situation. That way we can arrive at it in a logical way rather than just riding off those emotions. This is another reason why I say I can't make huge obligations right after I've had coffee, because I'm a very agreeable person right after coffee. So I try not to make any huge obligations or commitments during that time, because I know I'm just going off emotions. It's the same way.
Well, it's an interesting dynamic because I always have to sit and reflect. Like, I don't say much of anything and I just sit. And what I try to do is just I write it out. So I'm kind of like, if I need to respond to anyone like verbally, I'll actually have it written out if there's a conflict in that or setting boundaries. So I'll write it out. I'll actually read it almost like if I'm reading, reviewing it, and then I'll see if I can articulate it because I try to be as clear as possible. It still doesn't necessarily sometimes is not 100%, but I'm always wondering like it where this balance is. And that's why it's been great learning from Brandy and stuff because I don't know. And then honestly with the work situation, it feels like the response would have been better if I was less reflective and more like you have to be the one that makes the most noise and is so irate for them to even like acknowledge you like there's a problem. So it's too much sometimes in these situations.
It really can be. Um, yeah, setting boundaries with other advocates and people that require the daily assistance. Danielle and Crystal bring that up. Sometimes we just need like a sounding board. We just need someone to just say these things. So writing it out, I think, is a great idea. But sometimes it's like we already know the answer. So I had a coaching session this morning, which I was getting coached, and I was like, they were like, okay, let's focus on a behavior change. What kind of behavior change do you want? And I was like, I need to learn how to relax more, have that transition period from working to going to bed at night. And I was like, how are you going to do this? And she just asked me the right questions. And that made me realize that I already knew the answers. They were just already back in the back of my head. And she just brought them out. She was genuinely curious as to how this was like, well, why can't you get to that transition period? Why are you not? Why are you? And asking these questions. So having someone that you can talk to, and you don't have to bring up names, because a lot of times we have mutual friends. So you don't have to bring up names. Just say, hey, I'm in this situation. I really don't know how to proceed. And I don't know which is logic and which is emotion. And can you help me work through it? And try to have someone they can ask those questions to say, maybe this, maybe that. And you already have the answer and you already know. And sometimes writing it down or actually just saying it out loud can really change the game for you. And write your boundaries out. I mean, goal setting is a huge thing that we do in coaching sessions. And we say, hey, like write down a goal. And when you say it out loud and when you write it down, it makes it solid, and then post it somewhere where you can see it. So write down your boundary for the week. If you have to practice it, just write it down and say, this week I am going to say no when I know that I'm already exhausted, or whatever it is. Make it something that's realistic and post it in front of your mirror or on your mirror where you brush your teeth every morning and every night, so you see it as a constant reminder.
Absolutely. I mean, all of this makes sense. And then, I mean, even Danielle brought up too is setting boundaries with people you need to rely on. So it's not like you can cut them off, right? and understanding what this looks like for those people, it is definitely challenging. I still have to use, like in those types of settings, I know I definitely try to write it down to make sure I make sense. I have a very I a different family life or two. Like my dad's a sophomore in the software engineering side, so he's very like linear with direct. You have to be short to the point. So if you set boundary, it got to make sense. You can't necessarily bring in a lot of feelings. So this is even what I told Michael about and having these discussions. So it definitely takes a lot of navigation for this, for sure.
Yeah, and I wanted to say something about what Danielle was saying about daily assistance. So there might be something else that's going on with the caregiver. So a caregiver can vary in really a lot of degrees for someone that's just there supporting you, like as you go through and you're doing everything, to someone who's completely like just needing someone to help them with everything. So there's a lot of degrees of being a caregiver. And I think sometimes caregivers are not underrated purposely or undervalued purposely. It's just, there's just a lot of feelings between being the person that needs to be cared for and then the caregiver. And then the caregiver may not feel like they can say some things. So, even saying if you feel like there's tension or you feel like there's something, there might be an underlying cause. A lot of times when we get into arguments with our friends, loved ones, or other people, it's not just because one thing spurred it up. It's like usually a buildup and then it's just that one spark that just sets everything out. So, it's like, going to the person and saying, hey, like, I feel like there's some things on my chest and I really need to talk about. So you never want to say you, because people immediately get defensive, but just, start with some positive things. Like, I value this and, this and that. And then say, but I feel like there's something else. And then kind of just tap into it and just to get that conversation started. And that's their leeway to come in and say, and when they start talking about it, don't get defensive to the point of, and I hate saying don't do something like I'm being very like that, but I'm saying like try to be open-minded and listen to where they're coming from and put yourself in their shoes and try to be open and not focus on a response, but really hear everything that they're saying. Because if you immediately jump into a defensive and start defending yourself, you're going to cut them off. They're not going to talk about anything. And, I was talking earlier this week about some arguments that my husband and I were in a very tense phase of our life right now. We're both starting businesses and it's very stressful. And, we have to just break apart and then come back and say, there are some things that we need to talk about. And we're both very hesitant to go into it because I'm an emotional person. We don't know like how I'm going to get. But afterwards, we're just like, oh, that's so much better. And our relationship is so much better and stronger because we had that really open, honest conversation. And there was no like, walls being put up.
Well, you're bringing up more like also communication too. I mean, this is such an in-depth topic in different areas because sometimes too, when it comes to relationships, people have previous relationship patterns that they've seen and they bring that into the relationship as they're trying to evolve. And I can speak from this from my own personal experience of even like, because you brought up your relationship too, is mine when first, like, I mean, with past relationships with Michael, like underlying things with some of the people that were he was in a relationship with, and I'm very literal, so I say what I mean. So if I'm okay and you're okay, I mean that I'm okay. So there's no manipulation involved, but you're just adjusting to this as you communicate and learn how each person communicates. But it's tough if people don't feel like you're being truthful with them. So it's this whole like breakdown in communication that could possibly come up, which is really interesting in these dynamics that we have with this stuff. And I just want to say really quick hello to Mo from Chicagoland. She definitely, it's great to see you too, because I know she supports a lot of the YouTube stuff that we do. I appreciate you. And then also just seeing, oh my goodness, with the job of a nurse, like thinking about nurses and trying to accommodate for those of you that have fibromyalgia in the healthcare field. Yeah, these are, again, we were talking about accommodations, but in this job situation, can you even find those accommodations of like sitting down more and all of that stuff? So these are definitely conversations to keep having. Brandy, she did have a question for you, is what kind of shoes were you wearing that the doctor didn't recommend?
This is funny. Flats and heels. So the flats, I always thought they were just okay because it was almost like I was barefoot. So I thought that was okay at the time. And he scolded me in the middle of the hallway, not in like a demeaning manner or anything. He was just like stopped, and he's a very focused person. So he was like, why are you wearing flats? Like, you need to be wearing comfortable shoes. And I was like, oh, I thought they were barefoot. And he's like, no, this puts so much strain. And he went into this whole topic about how it puts strain on the arch, and I need to be wearing shoes, and, this and that. And then I was like, okay. So I started wearing better shoes. But then I found these amazing heels on sale. And I'm not a heel person, but this was like 2 kids ago. Okay. So this was like 10 years ago, this was happening. And I found these heels and I thought they were amazing. And I didn't know how to walk in them. And so my coworker was like, oh, bring them to work and I'll teach you how to walk in them. So we were like literally during lunch break up and down the hallways learning how to walk on heels. And he saw that, and he stopped again, and he was like, didn't we talk about your shoes? And I was like, well, it's just for a little while. He was like, even just for a little while, even just for a few hours, it's not good. And he started talking about how it can affect the entire body. And I didn't understand it then, but this is going to tie into something Melissa and I are going to talk about at a later time. But it tied into the fascia, and I didn't understand it until I started attending Dr. Vaughn's fibromyalgia group sessions during the week. And he taught me how the feet actually tie into the entire body. It's a whole thing. I don't want to take up a lot of time. It's amazing. But heels and flats were a big no. We need to find arch support and inserts to help with that.
Absolutely. And the fascia is almost like, this is a perfect transition that you brought it in, thinking. And for everybody out there, if you're watching the replay of this, please chime in if you have tips on setting boundaries, if you have tips for managing work life and everything that comes with it, toxic people, like what do you do? Please continue to have conversations as we move on to like updates, because as Brandi brought up, the Dr. Ron, we have some updates that are cool that are coming up. We're going to talk more about some of the programs that are available at Texas Center for Lifestyle Medicine that we want to grow into and expand into other states. But we'll be sharing more. I think in our next Friday Live, we'll be talking more about group health coaching a little bit more. If you are in Texas or you have a fibromyalgia friend in Texas, they have a fantastic group program, and it's led by Dr. Ron, an MD, medically trained integrative and functional medicine provider that they've opened up with insurance coverage. And we'll get some more information because Brandi and I were talking about this. So they do have it's a Medicare group, and they have 2 groups on Tuesdays that people can attend. It is billable through insurance. Not every different people, depending on your insurance, will have different coverage. We have heard from certain people there are insurances where you don't have to pay anything. So if that is you, please, I can't emphasize this enough, please utilize that group. It's virtual. You're with a medically trained doctor. It's a medically designed program, and you'll get far benefits. Like Brandi and I have been able to observe some of the sessions, and I think Crystal has also come. So this is legit. This is the doctor in the house of these groups. So,
And while he's not a specialist, he's not a fibromyalgia specialist, he takes a huge interest in fibromyalgia, and he's trying to figure out how to get these healthcare professionals trained in fibromyalgia so they can help their patients. So this is your opportunity to come into a group and sit with someone who has an actual interest in fibromyalgia, and he talks with us. Like, I'm not just an observer. Like, I get in there and I question him about all kinds of things and really talk about stuff. This is your opportunity to ask those questions and get some answers straight from the source, because he doesn't talk in terms that are above your head. He breaks it down. He shares screens and images and it's absolutely amazing.
yes, he is. And Crystal has been able to join some of the sessions too. And he does make sure that you understand it. He takes the time. Like, never do you see like I said, he's legitimately an MD. You aren't getting referred to staff. He's in the group, and sometimes he'll bring in guests and other people on the team. But you get him for like the time of the group, which is like 30 to 45 minutes, right? So he's there, he's answering, he's educating. So you can bring in stuff that's just like, this is beyond me of the timing that we don't see that. And I know everybody out there, you guys are looking for these fibromyalgia specialists, which are unicorns. And I'm not even sure There's some people that specifically may only treat fibromyalgia, which is probably few and far between. And then you generally have to pay out of pocket. Remind you, you have to pay a lot of money out of pocket potentially to see them. There are providers, though, that we're finding that do take insurance. We have been sharing a lot of them too that understand fibromyalgia quite a bit. So please utilize those providers. And we brought them into the conference to speak last year. We keep sharing. They have podcasts. Like Dr. Michael Lenz has a vast knowledge of this. He's always sharing in Facebook groups. Dr. Andrea Chadwick is another one. Dr. Ron is another one too. So these are people in this medical insurance platform that you can utilize to actually get proper help and adequate care for fibromyalgia. So we strongly encourage that. And then speaking of Texas Center for Lifestyle Medicine and Dr. Ron, we just wanted to let people know that there is a fibromyalgia conference for healthcare professionals in October. So you get a certification for healthcare professionals collaborative community that's in the beginning of October in Houston. So we'll be there supporting the event and meeting the providers, which is cool. I feel like we've entered a mythical land that I never thought would exist. So healthcare professionals will be collaborating with other healthcare professionals and talking about fibromyalgia in a very open-minded space. So the end result is that they can better help patients, all of us, which is cool. And they're definitely in different parts of the country. Yes, some of the providers are more centered right now in Houston, but the idea is to grow this and expand and also let other providers, hey, you're interested in deeper learning of fibromyalgia. We have people that are willing to come in and work with you and train you, provide certifications. And then Support Fibro is working with them to create a database of these trained professionals. So they've gone through, they've trained, they're communicating with each other. So we're putting together this network that you can actually utilize rather than some of the other databases we've seen. When you call them, they're like, oh, I'm retired, or I don't even treat fibromyalgia. Like they don't even treat fibromyalgia, even though they're on a database. So that's supposed to treat. So we really need to clean this up so people can get there, figure out where providers are with this goal. So, I mean, it's exciting, Brandi, to know that there's healthcare professionals being like wanting to train each other.
Yeah, and I love Dr. Ron's approach about it too, because a couple of weeks ago in one of the sessions, he was saying that he sat down, I want to say some type of surgeon, and they were having lunch, and he's connecting with all of these providers like almost on a daily basis, not just for the conference, but just to figure out how we can navigate this better and how we can do this better for fibromyalgia. And he said that he had a conversation with the surgeon, and the surgeon made some kind of offhand comment about he doesn't really know if it exists, or just the doubtfulness. Someone shared in the comments that they get embarrassed to tell people that they have fibromyalgia because so many people act like it's not real. So I don't know if this individual, that surgeon, was actually didn't know if it was real or what was going on. But Dr. Ron said within 5 minutes he was able to describe what fibromyalgia was, and in such a way where the surgeon was like, like he actually like believed that it's real, and he saw how it was real just through Dr. Ron's explanation. It's like Dr. Ron is on this mission to find people that don't know what it is and try to get them to understand what it is and to help their patients with it. And like Melissa said, it's like he's like this unicorn, like he's building this like land for us to be able to really learn a lot of stuff. And every week he's just talking about new things that he's learning about fibromyalgia, and the patients in the groups are teaching him about stuff. Like he had no idea what the difference was between a mouth guard and a mouth splint. And so this patient in this session taught him about it, and he's like, okay. And he went off on his own to find more about it and how it relates to fibromyalgia, and came back the next week and shared all this information. So he has this active interest in us and getting us better. And it's not just like, oh, he just says it and he moves on. No, he's following through with it. He's pulling a conference together to, of people of all kinds of backgrounds, not just medical providers, but like, people like dentists and stuff like that are coming together so he can teach them and figure it out. And it's absolutely incredible.
And we need more providers to come forward like that, because what we're having is these discussions about what fibromyalgia is. And we even see it in our patient community, which is something that I noticed too, is we have to be open-minded about science. Science is all evolving. So what we may have known or where we're at with fibromyalgia could change later on based on the science. Now, there is truth. Fibromyalgia is very underfunded, very underfunded. So a lot of these facts that get thrown around in our community was from research in 1997, 2003, maybe 2012. So we have a lot of ground to like pick up with. So please don't get stuck in black or white thinking and understanding. And this is what's unique with some of these providers and what we want to do as an organization is bring a variety of providers together that are thinking differently or have their ideas, and they can come together and train each other and talk to each other and really review their own patient case studies, because I know some doctors lean into a certain direction of emphasis, and I'm like, okay, well, the fundamental truth is we want to help patients. We want people to improve their quality of life. That's the end goal. So whatever treatment tends to work, because we're all so different, but the end goal is to improving quality of life for all of us as patients, getting the support we need. It's real. It's very real. So we're transforming all of this so you can get positive medical care experiences to move into a better direction. And that's why we're doing it with our patient education and with the medical providers. So getting more medical providers interested to share, be like, hey, I want to learn more about fibromyalgia. I've been afraid to mention it, but it's an important thing. And that's why we're breaking out of this finally, which I'm super excited about.
Yeah, Crystal mentioned something about going to the dentist and the medication for dental work, and that is absolutely truth. However, with Dr. Ron, it goes more in depth than that with the dentist. I'm not so knowledgeable in this. I'm still learning, but it's like, you know, how a lot of people with fibromyalgia, we have TMJ, we have a lot of tightness, we have issues to be able to swallow correctly. All of that is tied into our makeup of our mouth and how our jaw sets and how our teeth align. So when he's talking to dentist about that, it's on a very deep level of all the fascia that's through here and how that all works up, and you know, the benefits of a mouth guard versus a mouth splint and all of that. He's going into like the depths of it and really figuring it out and getting to the root of it, not just the symptoms of fibromyalgia, but he's really getting into the root of it. And it's absolutely incredible. I know somebody had mentioned that their rheumatologist didn't know about LDN. And then we had someone else ask if fibromyalgia can make a person extra tired. Absolutely, it can make us feel tired. LDN, yeah, the rheumatologist that not knowing what LDN, that's unfortunately that's common, but that's okay because we're working on it. I mean, it's not okay, but I mean, don't lose hope. We're working on it to be able to get more people knowledgeable about this, and people saying that their physicians are not seeing fibromyalgia patients. That's absolutely true. Melissa, you had a run in with the rheumatologist at the airport. As it says something similar.
Oh yeah, it was interesting because I've been traveling with a bag with the stickers from Support Fibro, and it says "We the patient." So it caught my attention, and he admitted he's guilty of turning away fibromyalgia. He didn't want to work with fibromyalgia patients. And here's the challenge, and we learned this from Dr. Pinkston's interview quite a bit too, because she's a rheumatologist. Well, first of all, the complexity that there's not enough rheumatologists in the country to begin with. So they're managing a lot of complex autoimmune conditions where there is more treatment and research available. So they do a lot more research in those categories and can provide more treatments that they see more results. So when the fibromyalgia patients come in, this is the challenge. There's not enough treatments available that have the best results. So a lot of us can attest to some of the medications we may have tried, which are FDA approved for fibromyalgia, but the success rate is so low that it's frustrating. So, I mean, it's hard for providers to juggle this and being able to then educate themselves when they're inundated already with a full load of patients. We are going to be addressing this more because this is another event we're going to be a part of again, is the American College of Rheumatology in November. We have a booth. We're going to be talking to more rheumatologists, and I'm glad Brandi will be able to go with me, because it's definitely this dynamic that we have to fill in this gap, and what that gap looks like for where fibromyalgia should land, what we can do to support rheumatologists more when it comes to fibromyalgia. Because right now, I mean, you're lucky if you can get a rheumatologist to treat fibromyalgia. They defer to primary care, which takes us back to this whole collaborative model, giving primary care even more resources to be able to involve other people like dentists, ENTs, endocrinologists, myofascial specialists. So, like all of the above, that is the key to all of this moving forward, like collaborative community care. I'm a health coach. Brandi is training to be a health coach as well. And we have experience in group medical visits. So, the same thing we're talking about with Dr. Ron doing for Texas Center of Lifestyle Medicine, we've done across the country with other clinicians. It's billable to insurance. So, we are making an active push for the fibromyalgia community to have more of these available. So that way you can get some of this care and support in a different environment, but it's supervised by medical providers too. So there's a lot to this. We're moving as fast as we can because we know that there is definitely a gap with the healthcare providers. We see it. We hear from a lot of people that they're left like with nothing. And I'm a case too, very medically dismissed. So we're working on a lot here too.
Yeah, we've been so busy. The summer was just so chaotic. It was really weird not doing our weekly live videos on Fridays, but at the same time, we were just so busy just doing. We're building up some programs. We were in Bethesda talking to researchers about how do we get these researchers out of their silos and talking to those patients. And we had an actual researcher saying that's what we need. We need the researchers connected with the patients. And we're like, okay, how do we do that? And they're like, email us. So we're going to be helping with that. And we're going to be slam packed for the rest of this year. But Melissa and I have personal interest in this because we know what it's like to not have that support and that care and being dismissed by medical providers. And we know that we're not just the off case, that this is something that happens across the board. So when I say Melissa and I are working behind the scenes tirelessly, that is absolutely what we are doing. We are working and doing whatever we can to improve it for everyone. So when we reach out to the community and we say, hey, like, tell us about, and then we ask these questions, we want you guys to chime up and say something and let us know. So that way we can make sure, because with us, no patient gets left behind. No patient slips through the crack. We are all important. We all need to be addressed. And if you don't want to do it on a public front, we totally get that. There's a lot of things that we want to remain private. You can send us a private message, or you can say, hey, like, I want to post about something. And Inspire, for example, you can post anonymously. If you're in my fibro parenting group, you can post anonymously. There's things that you can do. And we value your opinion. You may not have someone to talk to in your immediate circle, but you always have someone to talk to when it comes to Melissa and me. Reach out to us. Let us know.
Absolutely. And we could definitely use your support as a nonprofit organization too to spread the word. The biggest way to help us too is to spread the word, let other fibromyalgia patients know that we are an active nonprofit organization digging in to do the work. So I want to make sure that people don't know that they know that they're not alone. And there are things changing, like for good. So we're mentioning a lot of activity happening in Texas. Swing Care just made an announcement too that they've expanded in Tennessee. So fibromyalgia friends out there, if you live in Tennessee or know someone in Tennessee, so this is again coverage. I think it's United Care and Medicare that you would get the telehealth services through Swing Care with the app, and then also being able to do a telehealth visit with their medical providers. So we need these services more, and we need these stakeholders to invest in the community. So anything we can do to support this, please, because this is a huge deal. If you are in Texas, definitely take advantage of all that's happening in Texas. I don't know why everything goes to Texas. But Tennessee, this is huge. I'm glad they picked Tennessee. I hope to see expansion in other states. I can't wait. I've been waiting myself because just to admit people, I don't have a medical doctor myself. So I totally get it. And I think Brandi is struggling too to be taken seriously in this web of medical professionals who you're looking at endocrinologists, like all this stuff, like hormone specialists. It's hard. So if we can find more doctors that'd be like, okay, I get it. Let's take a pause. let's really look at you and take a look at what's going on, that would be tremendous. So don't give up hope. It's happening. Changes are happening, and we have a full packed year, and it's good because we'll be interacting with more medical professionals. Brandi did an amazing job too at the NINDS nonprofit forum in Bethesda. So we were talking to researchers. So we were nerding out. We have to drum up. If you know of people that are in research and maybe they're looking at the brain or they have neuroscience backgrounds, please ask them about fibromyalgia. We need more researchers that are enthusiastic to get involved, because the advocacy that we're doing on Capitol Hill, we're opening up funding, but we need to make sure that those researchers that are enthusiastic about doing that fibromyalgia work we want, like pathophysiology, biomarkers, that they can grab those grants. So that's the goal, because we've honestly, there's some research pathways I think we've had enough of. We can cool it. We understand. We've had enough with the E word of exercise. Guarantee it. Let's like figure out some mitochondrial health, sleep, all of the other things that we know come with fibromyalgia, because fatigue is definitely a component of it. And whether it's a deficiency in the mitochondria, a deficiency in ATP pathways, we need more science. We need to know brain health completely. There are so many different neuroglial cells, and we haven't researched enough, getting some hints of microglial, but there's other neuroglial cells involved in the central nervous system that we need to take a look at. We need to definitely look more at autonomic nervous systems, central nervous systems. So we got to have more of that research, and we'll definitely, that's why there's so much going on. So, but it's happening.
Yeah. And one of the things that Melissa and I have been discussing this summer is, as we're building up these programs, we're like, okay, we need to be able to get some volunteers, because everybody wants to help in some kind of capacity and we all have our limitations. And so just to let you guys know that we are working on that right now, is that we're working on all the different ways that you can help with our nonprofit. There's been people that have reached out and said, hey, like, I love what you guys are doing. How can I get more involved? And we understand that there are limitations. Not everybody can do as much as the next person. So everybody is valuable. There is a place for everybody in Support Fibromyalgia Network, and we are making that space available. So in the next coming, maybe hopefully month or so, we're going to have something on our website that's going to say, hey, these are all the areas that we need help in. Here's a volunteer form, fill it out. Let us know how you would like to get involved. And I can guarantee you, no matter what kind of capacity you are in, we are going to be able to find a way for you to be able to help us, because we need help. Melissa and I are not sleeping properly because we feel like we're so far behind. Like, we're doing so much, honestly, but we don't feel like we're doing it fast enough. And like, we want to clone ourselves to be able to do all of this work. And it's just not possible. So, but we are going to be opening that up so that way. And it's not just with advocacy, it's going to be all the way across the board of like different, because some people are more into the research and the science. Some people want to do the advocacy. Some people like doing the social media. They like doing all these things. So there's going to be a way, but like Melissa said, the one surefire thing that you can do is like, comment, share our post out, let other people know, because you never know who's living with fibromyalgia. As someone said earlier, you can feel very embarrassed to say that you have it, or the way that you've been treated in the past, that you don't want to say it. So always share it out, because you never know who is seeing it and who you're helping just by that one action.
Yeah, I mean, we're a community working together, so let's definitely support ourselves. And there's different paths too of getting involved. I know, shout out to Lupus Spoons. So we have an Empower Flower Craft taking place with her support group. We love our support group leaders that are really invested in being there for the patients too. So we invest back in them and their services. So that's like a craft and creative. I know we love our creativity, even though I don't spend as much time in that space because my head is in the science space, but we need people that love that passion for music, journaling, artwork too. So there's a space for everyone there. And we'll be continuing with our advocacy work as well, but definitely creating this vast community and vast network of people where we eliminate judgment. We come with open minds and open hearts to address all of this stuff. So please continue to communicate with us. What else do we have? Oh, we are going to have a save the date announcement. So we had to maneuver. There is going to be a fibromyalgia community conference online. We have saved the dates. I think we've pushed it. So a little bit later in November this year. So I know with the healthcare professionals conference, it's like geared towards healthcare professionals, but we're going to take all of that aspect and then change it up to gear it. So it's patient education, it's free, it's virtual. So we do have that recognized in mind of some of the work that we are doing with other events and announcements. But I think that's a full plate for now.
Well, I wanted to, you were talking about creativity, and I forgot to share this at the beginning of the video. We've been, Dave and I were traveling a lot this summer, meeting up with Melissa and doing some other stuff. And, we didn't get to spend a lot of time with our kids during the summer like we wanted to. And so it was literally like I was coming in, and within 24 hours, I was going back out and having to travel again. So I didn't get a lot of time with my kids. My daughter is an artist. A lot of stuff that you see behind me, even this bloom, she didn't make the bloom sign, but she painted it because it was an awful color. So she painted it. A lot of the stuff you see behind me are from my kids making it. We have a lot of creativity to help us deal with our own things. We all have things going on. And so when I came back, she was like, Mom, will you make some clay with me? And I forgot I had gotten this huge thing of clay for her. And I was like, sure. So she had made this little avocado for me. I don't know if you can, it's like
That's so
blurry, but
cute.
it is so adorable. It's so little. And I was like, oh my gosh, that's so, how did you do that? And she has like all these tools, and she's like, Mom, make clay with me. And so I made a lot of stuff. I made like a little donut and a mushroom and some other stuff. But I made this little support fibro ribbon.
Oh, wow. That's awesome.
It's obviously it's like going off to the side, so I can't even make a straight line when I'm writing. But I loved this. And she was like, I was like, I don't know how to make a ribbon, and I did it. And she was like, Mom, you did it. Look at that. I didn't even have to do it for you. And I was like, I'm better than I thought I was. But I have this up there, and I thought it was just a really a cute, and it's a reminder, because this is my advocacy wall, just to remind us of where we're going. I say us, and I mean the community, of where we're going, and just the light ahead, and doing better for all of us, because we all need it.
Absolutely. We need the community support. We bring in our pets. I know Crystal is a great reminder of like Pause for Fibro and her cutie doggies that I got to meet in person. It was awesome. So any of that, like bring it to the community, embrace it, lean into it. Because I know some of us, it's just such a serious life that we need like other ways to do movie nights. I know Brandi has talked about game nights and stuff like that. So if you have those ideas, please definitely share, because there's a lot of work behind the scenes coming in, and we'll be doing more educational videos. I know we're behind a little bit, or at least I know I'm behind, because people are asking about labs, which I had an interesting conversation with Danielle in New York about. Very brilliant, understands lab testing and stuff. Man, there's going to be just so many discrepancies. And if you actually read the files on LabCorp and Quest that are geared to practitioners, you'll understand why, because it's definitely not necessarily what we've taught. And what is normal, you have to look at it comprehensively rather than just one, and these full panels, testing at the right time. It's a lot of tricks to this that we don't get right. But your symptoms, like this is why doctors can't ignore the symptoms despite what is happening. And we see this a lot with the autoimmune conditions where they have dual, like they have maybe lupus and fibromyalgia together. They might have less autoimmune flare or less noticeable lab results for autoimmune, but their pain is through the roof. So it gets tricky with understanding labs. And that's why we need to work with the providers to understand the labs itself may not give the full blown like idea and scope of what's going on. And also inflammation is not measured in the brain through those labs. So we are seeing neuroinflammation in the brain. This is newer science for fibromyalgia. You can't get that through that normal, like those lab panels either. So keep that in mind of where inflammation may lie and where it's coming up, especially with gut-brain axis. So stuff to think about. We have a lot. I like this. Coordinate a Hulu watch party or Netflix watch party. There's a lot of documentaries, although I'm probably too serious. So I need all of you that have character strengths and humor. Please come to the table. My humor is very low. So creativity, yeah, it's a lot. And Mo, we need to have conversations for that too, because both of my results were also elevated for a very long time. and you just get dismissed because it's not that elevated, right? But it's still high. It's not that bad. You're not off the charts, so you get dismissed a lot. So we'll have more videos on that because I think we need to be reading lab values differently and keeping track of that as providers too. So
Yeah, and if you have any suggestions or you want to know more about something, just send it to us. We can either incorporate it into a live video, or we can, well, I say me, but it'd be Melissa because she understands that stuff better than I do. But she can create a video to help us understand that better. So when we say that there's no question that's a dumb question, we absolutely mean that. No matter how silly you might think it is, there is a reason why you're asking it, and we want to address it so you can understand it. That's one of the things, is like we feel very powerless with fibromyalgia sometimes and all the symptoms. And one of the ways you can take back that power is starting to understand it so you can start managing it and overcoming it. It might seem like it's impossible, but it is possible. You just have to be given the right tools, and you got to find those tools. So, and this is where community is really important. We got to lean into one another and help each other with that.
absolutely. And if you are interested in doing, if you love science or have the background, because I know we have a lot of nurses in this community too that want to share anything of their experience or want to share some science or research that they're fascinated with, we definitely invite you on. We don't have to do videos, or we could pre-record, or we could just do audio style with like podcasts, maybe like a image, or we can do something with it to make people feel comfortable. But if you have science and if you have research that you want to share, we definitely welcome it because it's a big part of everybody kind of getting involved and sharing what they think. So thank you everyone for tuning in. Definitely going to, Brandy, we have a lot we have to do this weekend and I have to study.
Yeah, no, I've got my final next weekend, and I was like, oh my goodness, I can't believe it's right around the corner. And then I get like a week off and I go into my master's program. I was like, oh my goodness. And then with, everything else that's going on, I was like, oh my gosh, like I can't sacrifice sleep. Like I'm already sacrificing sleep. I was telling Melissa yesterday, I was like, you won't believe how much I'm sweating. And her eyes just kept getting bigger. Like, you're really sweating that much. And I'm like, yes, when I say I'm sweating at night, like you can see it on me. And like when I wake up, it looks like I've been out doing yard work. I have so much sweat on my clothes and I have to change out. You can see my outline of my body on my mattress. And I have cooling sheets, a cooling topper, a cooling blanket, and a cooling pillowcase, and a cooling pillow, and two fans blowing on me, and my AC down low. And I'm still having night sweats like you wouldn't believe. But that's okay. We'll work through it. Hopefully it's just temporary. But we're getting things together, and I'm excited about everything that's coming. Really, I'm very excited about everything.
Well, let's get us back to Houston with like uneventful weather, and let's just continue to have uneventful things in the weather system, and I'll be happy. And we'll hopefully get to go to beautiful San Diego for the ACR conference, which is huge. So we'll be networking with more professionals and definitely be seeing more people on the road. We're trying to set up more meetups as we go into different places. So hopefully we'll be able to connect with all of you. I know I had to cut the tour short for multiple reasons, but the weather really like hit me hard. So sorry to those we didn't get to see. I know we have in our minds Chicago, Portland, other places in mind to see advocates. So thank you everyone for tuning in. Thank you, Brady. Have a good time studying, as I will too. So everybody have wishing everyone a low pain weekend.
Yes.
Bye.
Bye.